and how we connect all these micro small farmers through various technologies, supply chain processes, techniques, and then create a kind of great cluster for that, and so that consumers have access to all these quality products. Uh, some developed countries have done this, but in spite of, like, I don't want to say that Americans or Europeans who have done this in some way, contract farming and all, their farmers are very happy. Farmers are still on subsidies. So uh, India farmers are also on dependent on loan subsidies. Uh, so we need to look at this agriculture side in a extremely policy, because stakeholders are many, and many issues are there. But we need to understand the whole value chain to talk about health and happiness. I like to add this word happiness, because if you are healthy, you are happy. If you are not healthy, and if you are happy individual, a human being, you are a great resource. You can contribute to this world, planet very well. That is also proven, tested. Okay, so uh, primary care, healthcare is a basic. And if you look at, as I told you, that 85% healthcare is small people. And in the healthcare ecosystem, like since we are doing a couple of projects and research, we see that right from insurance company, then government regulators, then within healthcare there are Ayurveda, there are homeopathic, then allopathic, all this thing, then all kind of primary paramedical worker, nursing, doctors. And that pharmacy, because cost of care is very high. That's why out-of-pocket expenses are very high. Uh, and the cost of care contribution, not only the salaries of the nurses or salary of the, even the pharmacy cost is very high. And the transparency also a big problem, because in Bombay during COVID-19, we have, I live in Bombay, so I can give, it's happening everywhere. That injection is available from 400 rupees to 4,000 rupees. There is no transparency, there is no tracking. So if insurance company has to settle the claim, which value they will take. So claim settlements are delayed. Uh, so all these things, create angry customers. So patients are angry, and when patients are angry, sitting at hospital, they are shouting at hospital people. So hospitals are now angry with the insurance people. So there is the anger all around, instead of collaboration, instead of cooperations. So that is health, purely the healthcare sector. And then we have so many opportunities, like if you look at healthcare as a business platform, though they do not have industry status. I learned that electricity expenses in the healthcare is same as the entertainment industry, which is very costly. So cost of care will definitely be higher. Not only just cost of pharmacy and the lack of transparency in the pharmacy, and also the cost of utility, and then admin cost and other things. And the other revenues are also not properly capitalized. For example, medical tourism. Then at the Ayurveda side, the government is pushing a lot of schemes for medical value tourism. The Ministry of Commerce is also working on this. But in spite of all these things, still business is going to other countries, and business is still concentrated on Delhi, not other states. In spite of huge potential in South India, like Kerala, Karnataka, Tamil Nadu. So all these things are very much there. But health, the triple burden of health, as we know, that is one side we have disease, other side we have accessibility problem to the affordable unit, and another side is out-of-pocket expenses. So that is very high, and our poverty level. This pandemic has created 4 million, almost 4 crore. Yes, I think number is 4 crore new people to poverty class over last 8 months. So that's not a very good number, because we worked almost a decade elevated these people above poverty. Now they have gone down to again below poverty. So and if you understand bottom of pyramid BOP business theory, they are the people who are new consumers because this 100 million, 200 million Indians are not total India. India is 132 crore, 138 crore Indians are live in village and live in BOP segments. If these people are not happy, not self-sufficiency, livelihood kind of mode, then business also cannot be sustainable. Then our market is very limited in a domestic market. Then you have to go for export. But last 30, 40 years, export, only few sectors are focused. Other, it's not as a country, we did not work. Like my generation, last 27 years, I am in the industry last 27 years now. And I can see that, it's more service oriented. So manufacturing got less focus, export also. Export of IT, export of pharma, and specifically generic pharma has really boosted. We are proud to Indian manufacturing for almost 60% of vaccines of the world. So those, but they are not value added. It's more bulk productions. So as a business, value added productions, specialty productions are also important, and also export hubs are also important. Okay. Uh, but we are progressing. That's very important. And COVID-19 has accelerated that progress. So I like to be very, very positive. And some people, some companies, even small companies, they are in a survival mode, trying to be in a revival mode. And then some revival mode is trying to be in a growth mode or thriving mode. So uh, that is happening now. Though there are many problems, life is full of problems still, and we have many problems in terms of market, because both supply chain and demand side are disrupted. Demand is still very low. Supply chain got disrupted, coming back, got disrupted intermittently. Um, so so there are issues. So I'm still talking about healthcare and insurance sector, and the regulations. They have their own problem. Whether who will regulate this country? Insurance people will say will have the last say, or regulator will have the last say, or doctor will have the last say. So that collaborative mode is also not there. So should be a very transparent, overall holistic regulations to make things happen in this, so that the quality of care, when I say care, is everything. So it should be improved. Okay, and and now insurance company, I cannot blame only insurance companies, because they are commercial service organizations, and uh, they also sometimes say that my TPA, my third party associates, are not doing well, or we are not involved as a stakeholder in many policy making, or transparency is not there in healthcare systems, so we can't, and they work like silos, so that seamless, or, collaborative mode is missing. So collaboration is the key. In fact, it's not only just government-private collaboration; it's also private-private collaboration. So big companies should collaborate with small companies, big health chain or big pharmacy chain, and then parallelly we can see that over 8-9 months, the telemedicine has come. Then the e-pharmacy is growing. Uh, so and people are really taking it forward, that how big companies, when they buy e-pharmacy company or telemedicine, they picked up telemedicine as a kind of important division. Obviously it will grow, it will get invested, innovation will happen. So I'm hopeful that maybe some parts we need to do a lot, but some parts we have never done, it started happening. uh, so uh, So this is a healthcare part, which is very fragmented part, and at the same time, Ayurveda is also doing very well. With the help of government, specifically last 6 years, I have personally seen that Ayurveda, which is our ancient knowledge. Some people, some allopathic always contest that concept, that this is not science-based evidence and all this stuff. But ancient knowledge has its own beauty and effect. And during Corona also we have seen that people have started drinking kara. Chyawanprash business has grown like anything. Uh, so and any herbal formulation is accepted by all classes. It's a mass production now. Anything with herbals, any CPG products, consumer product goods. So I will not say that this is kind of should be thrown out. What some doctors, some allopathic may say, but this is really, in fact, even the tourism, medical tourism, uh, some chronic care are taken care of by Ayurveda very well, and they have a scaling system. They have developed a very good scaling system. So like panchakarma scaling and all this stuff. So they are also building team. And during COVID care, that news is not there, but during COVID care, they have done a great job. Specifically in a mild symptom case, not severe system case. Severe symptoms anyway, nobody can do anything. So, but severe, mild symptom case, many recovery has happened. Mortality is almost zero. So, so we have resources, we have talents, we are doing many good things. So business opportunities are there. As a business management students, as a professionals of biotechnology, there are huge opportunity. The challenge is how we convert those potentials, or how you unlock these potentials. So collaboration, innovation, reimaginations, those things we have been hearing every day. But practically, how many companies are able to do? How many companies I can see, since I work with, I talk to many companies, so, and I can see that easier said than done. Collaboration also easier said than done. It's not easy to collaborate and work with thing. Like I always give one example of my very favorite case study. I'm not going to discuss case study. I'll just give state this as example. This is the example from GSK when they tied up with Google. Verily Life Science. Some of you may know in strategy management is a case study that I usually refer always. The GSK's one side is a deep disease biology expert, and the other side, Google, is the miniature electronic data and software, and how these both giants can collaborate, form a joint venture, and form a company called Galvanic. So it's not a good Google Life Science as renamed as Verily Life Science, and Verily Life Science and GSK formed a company called Galvanic Bioelectronics. So it's a bioelectronic medicine. It's a therapy for chronic care. Now this it's a device. So biomedical engineering, the people are very much in demand, biotechnology sides. Because what GSK strongly believed that time, that communication between organs and nervous systems becomes faulty. So if you put a very small miniature device, you do some small surgical intervention and put that device and correct that the signal, then arthritis, asthma, those chronic care can be inflammations, you can get rid of. So instead of having tablets and drops and with the side effects, and then suffer pains and all this stuff, have some small intervention and then put that implant, which is less than a rice grain, and then and it's a battery charge. So at smaller the device, better. Then you need a precision is also better. So both Google and GSK has developed as a joint venture company and worked on this innovation. And nobody could treat that in a company like IT company or information search company like Google can develop a medical device. But GSK, which is a drug disease expert, biology expert, could a drug development expert could never think that using miniature electronics yeah, and also data and software, they could develop a kind of uh, bioelectronics therapy. So this is something, if I look at vaccine development, you can see a lot of all the vaccines, the big guys, including our Bharat Biotech from India, working through collaborations, Serum Institutes, and all this, everybody with the collaborations. So it's complementing each other, and you have access to, you create a consortium, so you have funding to availability, you have access to resources, and you also access to market. So that's something we are, as a business guy, we are learning a lot. As a business student, also we are learning a lot that how to develop a collaborations. And one more thing, I personally learned that private collaborations. It's not only just government, because government can't do many things. Yeah, we always depend on the government, and if government expect a lot, so we have to manage our expectations. So how we can do as a private, and within private, can you create a kind of ecosystems or cluster so that you can learn from each other, complement each other's strength, and develop something extremely innovative products which will solve world's problem. And so this is what I thought that about healthcare. And then I like to talk about one example from food system, because that's where the healthy and happiness, because we have to go back to the root. So cause and effect relationship. So if you look at only symptoms, then problems will never be solved. You have to go to root, and that's why food system we have to see. And as a food system, I can clearly see that it's a major challenge. During COVID-19, we have come back to basics, essentials. So people are still on essentials. We are not, our discretionary expenses are still less. So we are buying only important items. Now, I think pent-up demand and other things due to festive seasons, trend is changing probably intermittently. We have to see long term that this trend is, how it is going, which direction it is going. But what I like to emphasize here, that including our government, like our health ministry, who also has a FSSI regulator for food department, and then food has a different ministry. Regulators belongs to health, and food has a different ministry. Agriculture belongs to another ministry. So again, the three different ministry, and then Ayurveda is another Ayush ministry. So we have another, coordination also for different ministries. So that coordination skill is a need of the hour. We cannot blame that government needs to have one. And if you have everything in one ministry, then you have another problem. And then you have a four different ministry, then you have another problem. So basically, you have to adapt. So adaptability and the coordination skill that you need to develop. So coming back to food system, that food system somehow got skewed towards certain direction. So animal agriculture, like animal husbandry and all this stuff, they are creating a lot of pollution to air and water. Diversity loss is happening. So many companies, food loss, food wastage, as I told you, is happening. And greenhouse gas emission, unfortunately, after fossil fuel, the food system is producing second largest producer of greenhouse gas. So that's something we need to address, because climate change is also another issue. So as a responsible company, as a responsible corporate, as a responsible business leader or student, we must know this, that how to address this. It's not just one piece I pick up and then address that piece. Systemic view, a big picture view is very important, specifically in COVID-19, because branding, reputation, trust, transparency, those words, ethics, corporate governance, ESG format, environment, society governance format, those things are now keywords, right? For investors, for employers, for employees, for teenagers, for Generation Z, millennials, consumers, uh, activist shareholders, activist consumers. So we need to be careful. It's not that we just introduce something and then withdraw something immediately. Uh, and another paradox in food system is we have uh, uh, 2 billion world population with suffering from obesity and 1 billion population suffering from hunger. Uh, very, we have no answer to this paradox. And then we are also, we have great food productions, but we waste 40% of that food. We throw them. And 30% of that waste generate from our home, individual home. So even from our home, education is to start from home. That food wastage, not only just restaurants and catering companies and hotels and all, even at our home we waste a lot of food. Uh, so that's how rebalancing, which is a major challenge for big corporates, starts from there. So how I include everybody in the systems, and then reformulations, reimagination of reformulation of the food, because food, when you want to produce a tasty food, it has to be fat, salt, and sugar. And if you look at our regulator all over the world, they want you to reduce fat, salt, and sugar. If you reduce them, how will you have taste? You have a very good ice cream, looking very nice, but it has no taste, and it is costing you, 200, 300 rupees. Who will buy that innovation? Nobody will buy it. So taste and nutrition can, how you make sure that it can go together, how you make sure that it should work together, and also delight consumers, and not only delight, it's also make them loyal. Because loyalty, again, today is not by virtue of your packaging or brand name or legacy. Today, our consumers, specifically Generation Z and millennials, early millennials, are very, very, I don't know, they like ethical statements, they like sustainability statements, they like circularity. Uh, how much they don't know, they like climate, they like environment conscious company. That's true. you know so if you want to make them loyal, you have to work on those projects, in that directions. So like recently Unilever has declared that they like to reduce food waste. They like to be on a plant-based diet. Nobody is dictating you what you should eat and why you should not eat. That's very clear. We are not in that kind of narrative of business. What we are here as a responsible corporate citizen is that we are a responsible company, and what we do, we are fair to everyone. Like if farmer is farming as per sustainability development goals, then I must pay double. That's a fairness. And if animal agriculture is causing loss of biodiversity, wastage, loss, and pollutions and all this stuff, then I should balance it with plant-based agriculture. I will reduce little bit of animal agriculture till it comes back to normal, and create more plant-based agriculture reformulations. So and how I make that my origin, the origin products are chemical free, preservative free, natural. Uh, uh, so that's very, very interesting. And how you position yourself, how you get competitive advantage, all depends on this kind of game, how you do that. And it's not only just narrative, you have to really work. So it's not things differently, it's also doing things differently. And people can make this out, that who is only saying and who is also doing. And action speaks louder than words. So nowadays, our smart consumers really understand this, and that's how startup companies are really taking positions, in market. Many startup companies in all sectors, right from whatever thing I said, food system, healthcare, uh, even e-pharmacy, uh, then agri-tech. Even agri-tech, I mean, after food system, we should also a little bit talk about agri-tech, because everything is linked, and big picture, the systemic thinking also include thing, because that's the origin. So how you minimize the insecticides, judicious application. Like in our country, we can't use drone for insecticide spray. government is still working on this. But in other countries, developed countries, they use drone, which is very, exact amount of good insecticides, so you don't overdose them, and it exactly stayed beneath the crop to kill particular insects or rodents, and so your soil health is also not disturbed. So when you use them, so your products that agri produce, if input is properly used and properly spread, uh, so your agri produce is also good, and your farmer also spend less money, because agri input cost is very expensive. The cost of cultivation goes up because of unnecessary overdose of agri input, and if that is under control, farmers are also happy. And if technology intervention is there, farmer produce, farmer and consumption point, both are connected, like micro supply chain, which is many startups are working nowadays. But issue is the scale up, because when you apply technology, deep technology, you can handle 30,000, 40,000, or maybe 1 lakh farmer, uh, but not crores of farmers that we have, and that too small and marginal farmers. For that, we need massive, different kind of infrastructure, which people are still thinking and working on this. It will take some time. Uh, but so, in brief, I like to talk about this agricultural systems, which need very good attention, understanding by all the stakeholders, including our sessions today, specifically students group, and then food systems, which is urgently require rebalancing, and purpose-driven business, like if you look at Nestle, if you look at Coca-Cola. Coca-Cola, even in India, for last 7 8 years, working with Nagpur orange farmer, Himachal apple farmer, Chittor mango farmer, uh, doing technology transfer from South Africa, trying to increase the yield and buyback arrangements, so the farmer income also goes up, and Coca-Cola also gets best quality raw materials for their beverage. And because we have an agri-climatic zone, so we don't have to import fruits and vegetables. We have to, but we need some technology transfer like this, so that yield goes up, and the people are motivated to work, and that should be a kind of customer, like Coca-Cola is here has a buyback arrangements for with the customer for all this special fruits. So so that is very that is circular concept, that and sustainability goal also taken care of. And if this is the way each and every company works, with a kind of responsibility, with a value added mindset. I know we have many infrastructure issues, we have policy gaps, we are still working on it, uh, and competitions are very intense. And with COVID-19, even before COVID-19, also world has gone into a little bit of protectionism. So there is a kind of conflict between local supply chain and global supply chain. So problems are there. So markets are not very easy, and the collaborations like RCEP collaborations, or regional collaboration, trade agreements, everything has its own positive and negative, and also political side effects. So we need to be very, very careful. So as a business student, we have an additional responsibility, because if you are skilled, if you understand all this stuff, and not understand or seeing things differently, as I mentioned, you have to do things differently. So it should be skilled enough, or confident enough, when you join a new company, when you work for a company, that we start thinking on this in a very, very uh, uh, positive manner. Uh, so not only is this adding positive nutritional value in the food product for preventions, and also positive attitudes towards business, towards stakeholders, so that we have great corporate governance and great culture, and that great culture becomes your basically source of robust strategy, which nobody can copy. Like, in Hindustan Lever days, people used to call that you can take Hindustan Lever employee from Hindustan Lever, but you cannot take Hindustan Lever from this employee. You can take this employee, but you cannot take Hindustan Lever from this guy. It is embedded in his blood, his DNA. So that's why nobody could. Even the products, there are many companies. They have a better detergents, better soaps, But this company has established themselves through this kind of robust strategy for the last 60, 70 years, in spite of many competitions, many problems. Just for example, there are many companies doing great things. Great people are working in other companies also, and many startup companies nowadays. I can see last 5 years I'm working many startup, and I'm very very uh, delighted that few young people are thinking so differently, doing things so differently. Uh, so. Uh, so with this, I will stop here, and I think I have just uh, given my overall overview uh, about this health platform, how health looks like from my perspective. So
Thank you, sir. Thanks for a very, comprehensive points, as far as, health, related, aspects are concerned. It was like, I mean, if there is a textbook of 500 page, the
yes,
first 10 page, what is required in that 500, page, that your talk was, absolutely, addressing like that, right, sir? So what we'll do is, quickly we will have next 10 minutes of, question answers, in case, faculties or students have,
okay,
some discussion, point, with you.
sure,
But
yeah,
I'll have one point, before that.
yes,
You are also saying something in between key. There are a lot of business opportunities, for management students. Startups can happen. So can you just, I mean, in particular, tell us, in case we want to pick up and start a business proposal, what that one or two could be, specific that we can pick up.
okay. Yeah, your question is more from a startup point of view from students, or
Say there are 10 students, who are attending the webinar, and you
yes,
also said about, there are business opportunities in health related. In
absolutely.
case a student comes and says, "You sir, I want to start a business in health. Please tell me what I can do."
Okay, all right. So, see, as I told you, when I say health, health is a quite a holistic approach, and also I need to see where student has to see that where the ecosystem is now quite active. For example, I said that Ministry of Commerce and Ayush Ministry and the state governments, specifically from South, medical tourism, medical value tourism, where the startups are working very, very closely with government and also state ministry. That how you make sure that travel facilitator, healthcare, like hospital, how they should handle this kind of travelers coming from Middle East countries or Central Asian countries, even from developed countries, and how to communicate, because it's a technology intervention also, and we need a lot of innovative thoughts, like connecting them, because today these people are going to different places. They're going to Bangkok, they're going to other places. And even in India, it's also very much Delhi oriented, because most of our seminars, and Delhi being a capital, visa and all this stuff are more in very good in Delhi at this moment. So startups are working. I know that. So that is one area I can see that immediately anybody can pick up, and for healthcare, and also the insurance sector. I can see the second step, because insurance is growing like anything, and with COVID-19, health awareness has grown up, so people are subscribing to insurance concept, maybe premium and other things that needs to be, government also needs to intervene. uh, so again, whether as ancillary to insurance industry or as a part of a partner or collaborative partner to insurance company, because insurance company also has to ramp up. They have to collaborate with government. They have to collaborate with regulator, because today, as I told you, that doctors are not sure that who is their regulator. The regulator is a regulator or insurance company is a regulator. If injection vial is 400 rupees, and if its market price is 4,000 rupees, and if that claim is going to insurance, So how you manage that claim, how you bring that transparency, that's the area, gray area now. A lot of startups are doing research, and they are intervening, trying to do some platform. So that two things
Absolutely.
immediately is coming in my mind. And then food system is another system which is open, which is right from farmer integrations to dairy, or any kind of food productions or food marketing in a hyper local market, not mass market, hyper local market. Like in Bangalore, I know that some companies is selling A2 milk, which is a very normal, ancient kind of stuff, but they are selling in a different concept, and Bangalore is accepting that concept. Like in Bombay, we have a pride of cow coming from Govardhan, and there are many startup company doing this kind of very high quality dairy business, and also bakery business as well, with some plant-based agriculture concepts. That is second, food system where you have to, rebalancing is very important. If you have to not only just create and deliver value, it also communicate that value. So new business proposal from startups or students should have that comprehensive uh, thing. So that's what
Yes.
immediately.
Absolutely. Absolutely. Any participants or faculties or students have any discussion points with uh, Jayanta Roy?
So I have a question wherein
Yeah.
it was a very good talk, sir. It was very insightful, I should say. The thing is, I wanted to know, like, you had a strategy wherein you were saying that we have to reduce the food waste, while we also have to take into consideration the taste and nutrition to attract consumers. What would be the strategies, or what are the things that we can do in this regard?
Absolutely, because that's a that reformulation game which is going on for last, I think, 6 7 years, very strongly, very closely in all FMCG space. So, and specifically conflict between taste and nutrition, because one side you have a health, other side you have a taste, and how you rebalance that, reformulate that, and at the same time you have a kind of requirement by different sets of consumers, because some consumers want a bajra, millets. So those millets concept actually our own assets. We lost that assets because of green revolution wave, because that time rice and wheat was very much required, and so that's why millets got lost. Now those millet concept is coming back. Okay. Now, how you use that millets in biscuits, and how you create a new taste with a millet biscuit, because if you wheat flour biscuits and millet biscuits should not be very different taste wise. So there are many ingredients available. There are many suppliers available. Technology transfer is also available, and they also have reformulation assistance if you have collaboration with them. And that's where the startup are playing huge role. For example, turmeric milk, which is a very old concept in our country. From thousands years, we know turmeric milk. Now, suddenly, turmeric milk has become a hot commodity, commercialized product, very popular product, right from Amul to, startup company, Milk Mantra, and all these companies are doing very well in this. Then ginger, tulsi, and all this stuff, even in milk. So, uh, so that's where the startups are very, because they are very nimble, and the decision making process is very fast, and they're hyper local. That's very important, because hyper local and hyper regionalized thing is the first step to start. You cannot be mass market from day one. You need to be very hyper local, hyper regionalized, and then you slowly scale up. Yes.
Yeah, absolutely. Absolutely.
So I have one more question, if you don't mind.
Please.
So the thing is, like, you were also talking about these COVID pandemic has accelerated the healthcare and the supply chain management. Even though that there are a number of constraints from the insurance people or the regulatory people, how do you think we as biotechnologists can contribute to this issue?
Yes, I mean, biotechnology has, immediately I can recollect one example that Unilever Group has tied up with once startup company, but not from India. It was from Europe side, on algae. So algae and food, how you apply biotechnology to produce, algae as a raw material or ingredients in the food formulations. How you use live bacteria like probiotics, even in your not only just dairy, even in your other food products, so that your digestive systems, immune systems, even your brain power, memory power, neuroscience. So biotechnology is going to be a future. All future products depends on biotechnology and biomedical thing. I mean, that's my personal experience because, and I've given example of GSK. That's a very, just one example. There are so many examples I can see, and then enzymes, then food protections, preservations. Biotechnology has no limit, infinite opportunity. But only thing they have to do things differently. That's my only request to the future managers, that not only just reimagine or see things differently, they have to act and do things differently. That's where the gap is.
So we just have one question being typed, in the public chat.
Yes.
Do you think that people should consume more of a local product because of the suitable metabolism of the people in a particular region?
Well, that trend is towards that. There are many local recipes which we forgot because today, because of social media, because of smartphone, because of our lifestyle, we lost connection with our roots. If you ask small children that and show them a cauliflower and ask them where this cauliflower is coming from, they will say it's coming from Big Bazaar. They will not say it's coming from farm. It's a farm products. How you cultivate that knowledge at roots, which is our roots. Because you said agrarian economy, specifically those who want to be in this food system, health system, and agri systems. You know, if you connect with these old systems, they have they really like this. For example, khichdi. Even Americans doctors, I hear that they recommend khichdi when you have a digestive improvement scheme. And it's a very traditional products. Dahi, the curd, which is a very traditional products. So those products are local products. And last 10 years, you can see that packaged dahi, packaged curd or packaged yogurt has overwhelmed the whole market. We hardly see now home cooked, homemade card. So that's how the transformation is happening. It's towards that only.
Thank you. So thank you very much for all your comprehensive, understanding of the food. Understanding. But next time when we are eating food, we need to consider all these factors. When it goes inside. Otherwise, like your topic, which says that health and healthy would not suffice. If you just keep eating, without understanding what is health and what is healthy. Right, sir.
Yeah.
Thank you. Thank you very much, sir. And yeah. Go ahead.
Happiness also. Happiness also.
Happiness. No, once you have good food and
Yes.
the health is good, obviously it ends into happiness. Okay?
Absolutely.
So those are all the three, correlations.
Correct.
They say that, sir, your face is the index of your stomach.
Okay. Yes. True.
Yeah, your face will always say, how well, your stomach is being there, on that day. If something goes wrong with the stomach, obviously that is reflected, on our face.
Absolutely.
So we have, Yuvraj, who has his honor, to thank you, for being with us. You said 30 minutes, but you took almost, 70 minutes. So it is like we had a double presentation of yours, double, presentation of yours. So
Yeah.
they say that, buy one and take one free, something like that. So we had 30 minutes, but we got, 80 minutes of yours.
It's always pleasure to interact with this kind of
That's
think tank students and also faculties. Yes, it's all my pleasure.
So next, in case there is a request for invitation, just be with us, sir. For such
Sure. No problem.
Students,
Yes.
advantage. Students' advantage.
Sure.
Yuvraj, you're there to
Yes.
thanks, sir.
Yes, sir. Well, speaker of this evening, Shri Jayanta Roy, head of the Department of MBA, Dr. M.M. Bagli, sir. head of the Department of Biotechnology, all faculty members, my colleagues, participants, and students who have gathered here for this webinar this evening. A very good evening to one and all present here. First of all, let me offer my sincere acknowledgement to Shri Jayanta Roy sir for a very healthy presentation. It was truly a healthy presentation on the topic that is health, the importance of being healthy. Uh, Sir gave a very handful insight on health. Some of the key points that I really liked were about health means happiness. My health is my responsibility. Health, especially in context to the agrarian economy, which India was always very much proud about, and the healthcare ecosystem, and especially unlocking the high potential of the healthcare ecosystem in India. Sir, I truly feel and take this opportunity to extend my sincere thanks for being here with us, for sparing your valuable time plus knowledge and experience. Thanks a lot, sir.
Thank you very much. My pleasure.
Thank you very
My,
much, and I'll be
my
in touch with you, and let us collaborate and move forward, sir.
Sure.